Today we came back with another new episode, and in this video we'll see how traditional Chinese medicines treat the coldness of the limb. Let's see what's the cold limbs according to traditional Chinese medicine. You're already watching the video on the screen that we are treating a patient with cold limbs, and with the acupuncture we're trying to improve the temperature. According to traditional Chinese medicine, cold limbs can be attributed to various imbalances within the body energy, like known as qi and blood circulation. Here are some common reasons for cold limbs according to traditional Chinese medicine. So first of all, we can have yang deficiency. In traditional Chinese medicine, yang energy represents warmth and activity. When there is a deficiency of yang energy, the body may not generate enough warmth to adequately circulate blood to the extremities, resulting in cold limbs. And also there is another reason, which is spleen qi deficiency. The spleen in TCM is responsible for transforming food into the qi and blood. When spleen qi is deficient, it can lead to poor circulation and inadequate distribution of warmth to limbs, causing them to feel cold. Next is kidney deficiency. The kidneys are considered the foundation of yin and yang energies in the body. Kidney yang deficiency in particular can result in cold limbs, since yang energy is responsible for providing warmth and vitality. Another reason is blood stagnation. So poor circulation or stagnation of blood can lead to cold limbs in traditional Chinese medicine theory. Blood stagnation may occur due to factors such as injury, prolonged sitting or standing, or lifestyle habits that impede circulation, or can be the varicose vein. That's kind of reason. So there will be blood stagnation, low blood circulation of the extremity, and low temperature on the extremity. And also exterior cold invasion. We can also say that according to traditional Chinese medicine, exposure to cold weather or environment can cause the body's defensive qi to weaken, allowing external cold to invade and constrict the blood vessels, resulting in cold limbs. Also, the dampness can be another reason. Dampness refers to an excess of moisture or fluids in the body, which can obstruct the flow of qi and blood, and dampness often coexist with their imbalances and may contribute to cold limbs. And another reason is qi and blood deficiency. Insufficient qi and blood production or circulation can lead to poor warmth distribution to the limbs, resulting in coldness. This deficiency can be caused by factors such as chronic illness, poor diet, or excessive stress. Also emotional factors, qi and blood stagnation that we already talked before, and some external factors like exposure to cold temperature, drafts, or swimming in cold water can lead to constriction of blood vessels and cause limbs temporarily. In this video, this patient is above 60 years old. He has no previous history of injury or swimming or low exposure to low temperature, so we might guess there might be qi and blood deficiency, also kidney deficiency, also spleen and yang deficiency. So we are trying to do here to acupuncture his local area, like in particular his coldness is in the lower limbs. So we will acupuncture lower limbs, and it will help to improve the blood circulation in his lower limbs, and in that way we are treating the blood circulation and flow of qi. So if the qi and blood circulation is improved, that means also the temperature of the lower limbs will be improved. In that case, to do acupuncture, we first prepare the patients, then we disinfect in the local area, then we insert the needle. But to improve blood circulation, especially what we do, we just insert the needle a little bit in the local area where the temperature is very low. Also, we do the deep stimulation in the fixed points. Those points are very important to improve the blood circulation of the lower limb. That's all for today. Thank you so much.